So research shows that men are most drawn to women's mouths, especially when they're wearing lipstick, highlighting the lips, of course, more so than any other feature. It's the mouth, in particular the lips, then the teeth, but lips are by far number one. What spurred this video? Well, I had a patient come in last week and she said, "Doc, I had an awkward first kiss moment with a guy I'd been hanging out with for a few months." She said everything was going well, but then she said, "He jolted me out of my stupefied trance." So I was on the edge of my seat, of course. I said, "Well, what did he say?" He said, "Oh, wow, your lips are real," like he was in shock. He then went on to say, usually women with big lips have them filled. They have fillers in them. And when you kiss them, it feels like you're kissing a tube of silicone. So I knew then, after she told me this story, that I needed to provide you with more natural options for lips that aren't filler, although we'll talk a little bit about filler today as well. You see, the lips are also the way that the human brain distinguishes between men and women. Other studies have shown that lip size in women is a key sexual attractive feature, and that women with fuller lips tend to be very popular and more popular. So there's no question why women have the impulse, I did say impulse, to emphasize their lips. And now it's an $800 impulse if you're getting fillers. That's what a vial of lip filler costs today in a reputable, well-trained clinic. But not today. I have something better, less expensive, and more natural. Some of it is totally natural. Let's start here pretty much with free and proven. The number one solution, I'm going to give you 2 DIY formulas from my in-the-know patients who look amazing and use these. Number one is a cinnamon and olive oil lip scrub. The ingredients you're going to need: 1 teaspoon of ground cinnamon, 1 teaspoon of olive oil. I love olive oil. And that's it. What do? You mix the cinnamon and the olive oil and you create a paste. You apply the mixture to your lips and gently scrub for about a minute. This lets your lip get more, of course, moist with the olive oil, but it adds a redness and it plumps as well. You're going to leave that on for about a minute and let the cinnamon's natural plumping properties take effect. Then you rinse it off with warm water and apply a lip balm to keep everything sealed in. Here's a second recipe that my patients like and tell me about. Peppermint oil lip balm. What are you going to use? 1 tablespoon of coconut oil in this case. You could use petroleum jelly. A few drops of peppermint essential oil. This is essential oil, not cold pressed seed oil, but essential oil. What do you do with this? You want to mix the coconut oil with a few drops of the peppermint oil. Apply the mixture to your lips. The peppermint oil will increase blood flow and it makes them red and plump. And there's a longer lasting effect too. Some people like to massage this around. And then of course you're going to wash it off after a minute or two. Now, if you don't want to make your own DIY options, you want something you can travel with, carry around, it's easily kept in your purse, you think of a simple lip plumper. I actually put all of my favorite ingredients into mine. These are amazing if you haven't tried them. They're portable, so you can take them out at night with you so you get that immediate effect when you want it. The results, of course, are immediate. And with the medical grade ones, you're getting longer term effects. It's easy to reapply them. And if you use the right mix of ingredients, the lips naturally get a sexy look to them. Here's what you want to look for if you're buying these. You want to look for immediate acting ingredients, but you also want long-term lip plumping so that if you stop using them for a week, 2, 3, 4, that you're still getting the benefits from using them for the few weeks prior. The immediate ingredients you want to look for are menthol and camphor. I like those 2 the best. Longer term players, there's 3. The first one's peptides. The second one is retinols. The third one's just a super ingredient, is called niacin, also known as vitamin B3. It works on the lips to plump them, mainly through vasodilation. It opens up the blood vessels to the lips. There's not a lot of fat in the lips. That's why fat transfer to the lips, a lot of people ask, it often doesn't work that well. But niacin opens up the blood vessel to the fat that's already there and plumps them. When you put it on topically, it increases the blood flow and that also increases the redness. So you get improved circulation more oxygen, a healthier, more red-looking, plumper lip. Everything that we want. Now, a third natural thing you can do, you have to go to a clinic. It's not fillers, but it's your own blood draw. I call it plasma lip, and you can go to plasmalip.com. It's a simple blood draw. Spin your blood down. You get your exosomes, your growth factors, your mesenchymal stem cells, and those rejuvenate the lip. What we see, not huge lips from this, although depending on the amount you put in, I use about 2 cc's, one in the top, one in the bottom. You get more redness and a plumping of your natural shape. Now, let's say you don't like the shape of your lip. We talked about that in the beginning. Really, the only way to change the shape of your lip is with cross-linked hyaluronic acid fillers, what you guys know as typical lip fillers. And I want to tell you a couple things here so you get your mind around this. Let's say the mouth is too small, that you think you have a smaller mouth, not wide enough. Then we can fill to the edge of the mouth to give a wider look. And fillers are robust. They're stiffer, which is why that guy said, oh, you can feel fillers, because people kind of overdo them sometimes. But it doesn't have to be that way. They can feel natural. But if you're trying to create shape, then yes, we use stiffer fillers, widening the mouth. Let's say you felt like your mouth was too wide. You can play with cheek volume, for instance, and when you fill the lips, you stay central. But having a wider cheek, if the facial dimensions can take that, that will make the mouth look narrower, or even widening the jawline if the facial angles can take that. By doing jawline filler, it widens here, thereby relatively making the mouth smaller on the face. So there's lots of tricks and tips you can do, but lip fillers themselves don't have to feel stiff. You can choose soft ones, you can choose stiffer ones if you're trying to create shape. From risky to less risky, of course, we talked about the DIY recipes, not a lot of risk at all. And then the topical that I talked about, the Rajani MD Lip Plumper, pretty much no risk. And then you go to PRF. PRF is an injection, but again, it's all your own natural stuff. Your risks go down. With lip fillers, you want to think about, yes, you can get occlusion where you can block an artery. You don't really get blindness from the lips. It's theoretically possible. There are a few cases, but blindness is more with the glabella, with the nose, with the temple injections of fillers, not so much the lips. The lips we inject very superficial. Remember, I said there's not much fat in the lips. It's muscle, skin, and collagen layers. We used to use cannulas, and I still do sometimes for the lips, but when you're creating shape, using the needle is pretty much just as safe as a cannula, and it allows us to shape the lips better and work on the vermilion border. So lip fillers, they're great. I like them, but you may start with your more natural and work down to your lip fillers. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.